To show you how easy it is to file a claim with Geico, we hired a Shakespearean actor.
Oh, woe is me. Wherefore are thy claims help when I hadst a fender bender?
Pardon the interruption, but when you file a claim with Geico, your claims team will be in touch right away.
But willest they forget about me later when thou needest updates?
No. They'll always be there to, helpeth you out.
Well, I suppose that I should bemoan something else, like my lactose intolerance. Oh, whyest must dairy disagree with me so savagely?
Geico. Great service without all the drama.
Live by Live has all of your favorite music, and you can listen for free. Whether you hit play on one of our hundreds of curated music stations or create your own custom artist radio station, you'll find the music you love on Live by Live. Visit livexlive.com or search LiveX Live in the App Store or Google Play and listen for free now.
Welcome to the Beverly Hills Plastic Surgery Podcast. I am here today live with Dr. Millicent Ravello. Dr. Ravello, how are you doing?
I'm doing great. How are you?
I am doing really well. We had a bit of a rough start this morning.
Ooh, let's say that we were supposed to have a surgery this morning, you and I.
Yes.
At a local hospital. And
Who will remain nameless.
And I got a call from the patient at 5:30 this morning, not feeling too well, and case was canceled. So we met up somewhere else instead.
Yeah, so that was like, all right, see you at the gym. So that was it.
So we
no OR?
Nope. Instead of operating together, we ended up at Equinox.
That was good. I did not want to partake of the cycling class that you were into. That looked like it was going to be pretty hard.
That was a good class. I'm glad I snuck into that one. I'd rather have been operating, but a spin class was a good backup.
So I did weights, and I did the elliptical trainer so as to not beat on my knees too badly, because I beat on them enough with that Orange Theory I do. But it was good to do some weights, and then here we are.
And then we had a full day of patients.
Yeah, I did a little operation.
And then here we are.
Doing a live podcast, which we are going to talk about based on suggestions from the listeners. We're going to talk about oncoplastic breast reconstruction.
Yes. Oncoplastic reduction, oncoplastic reconstruction is a type of breast reconstruction for breast cancer patients. And the idea is that you are taking someone who has large breasts and doing what would typically be considered a breast reduction, but in a way that also allows the cancer surgeon, the oncologic surgeon, to get out the cancer. So these are patients that have a diagnosis of breast cancer, and they are a candidate for what's called a lumpectomy. Lumpectomy, partial mastectomy, they're used interchangeably. And the cancer is removed as part of the breast, and then the patient goes on to get radiation afterwards. And in the properly selected patients, that has equal outcomes to a mastectomy. So
equal outcomes in terms of survivability
survival
of their cancer.
Of their cancer, correct.
We're going to discuss the cosmetic and reconstructive outcomes separately.
Yes. And these patients who fall into this category typically have large breasts, and they may have qualified for a therapeutic breast reduction just based on the size of their breast alone. And these patients, especially if they're only having a unilateral breast surgery, are very hard to do a full-blown mastectomy reconstruction on. So if they were to have a mastectomy, remove all of their breast tissue, they are very hard to do a reconstruction on, especially if you're using implants, because you can never get symmetry to the opposite side. The opposite side is a large, natural breast, and then the mastectomy side is a firm, high-sitting implant. And no matter what you do, you can never get a good cosmetic symmetry reduction procedure. So in these patients, they're great candidates for this. So we do the reduction, we take out the extra breast tissue, we lift the nipple areolar complex, and the specimen that is removed is the cancer specimen.
Right. And that's the key, is that this is a cancer operation.
It is
first and foremost
cancer operation, and it's great for that because it really gives the cancer surgeons free reign to take as much tissue as they want. A lot of times, if we're not doing this in combination, or maybe the patient has smaller breasts, sometimes they can be a little nervous about taking too much tissue and leaving the patient with a very deformed